ka Sorkar Mekhalia kelas sedang Bniah Jinghikai ya ki Doktor ban pentikna ya ki Rukom Peit Bniah ki ba Kham na kabenta u Khñiang Jingpang human metapneumovirus HMPV hapo kani gejala u principal secretary jong katanat ka kod kekhia u Sampat Kumar ula ong ba la pethu baru ya ke Jingpang severe acute respiratory infection bat ki we ki Jingpang ki bakta ya kabor ring bat penhiar mensim hadian baladon ki briu ki balayo ya ke Jingpang HMPV hapo kani kari da ka bakren shai ba omdai ban khuslai ula benrap ru balada don ki badon ya ki dakishin jong ke Jingpang bayong khri ka bajur lani ka flu ki dei ban long ki ba husiar bha bat ki dei ban pentikna ba kim pen sapriang ya ki Khñiang Jingpang.
As I said, like we have been training our doctors on how to actually have more surveillance. Basically we have this SARI and ILI cases, we are observing them and seeing that those samples are also being tested so that any HMPV kind of things are there or not. So that's a process has been there. There is a proper system is there and we have been. But only thing I just said, if they have any flu-like symptoms, they have to be careful in terms of actually to see that they are not spreading to others.
Katanat social welfare kalawat banyo cing tuklar